There is nothing done in spine surgery from a minimally invasive standpoint, from a cutting edge standpoint, that we're not doing here. And we're committed to continuing that. And so when we see a new technology become available, we're out there, we're learning the technique, we're going to the courses, we're training on it, we're talking with the hospital administration, trying to work as a team to make sure that we acquire the latest, the newest technology to allow us to do these procedures in a way in which will benefit patients more. Now with image-guided systems that we have, the ability to obtain a CT scan intraoperatively and then use that patient's specific CT scan of their own spine using their own anatomy, we can now place instrumentation in the perfect position and not be just basing that placement on what I think the anatomy should be or what I think the position of the screw should be. We know absolutely that we've placed it in the right place. And then after placing it, we have an intraoperative CT scanner that we can do a very quick scan to verify that the instrumentation is exactly where it should be before the patient's awakened and taken to the recovery room. So the cases of low back pain with pinching of nerves, where we have to go in, take the pinching off the nerves and then stabilize the spine, the ability to use image-guided assistance and placement of instrumentation allows us to take what may have been previously an incision like this down to an incision more like this. And so, again, decreasing the amount of exposure we have to do to accomplish the job, to get the job done, to get the pinching off the nerves, and then to place the instrumentation to stabilize. You couldn't do that unless you can see clearly. And so before, that meant bigger incision to be able to see clearly. Now we're using technology to see clearly and doing it through much, much smaller incisions. Yeah. And that's what minimally invasive surgery is. That's what minimally invasive spine surgery is. It's not doing less than what's needed to accomplish the goal. It's accomplishing the goal through a smaller incision because we have technology that lets us see what we need to see to do the job well. We're a level 1 trauma institution. We see lots of folks with spine fractures that have caused their spine to become unstable, and we have to stabilize that so that we can get people up and walking and moving and mobilizing again. And so the ability to place instrumentation for those trauma patients without doing so much large incisions, muscle stripping, greatly increases the chance of healing without infection. And it allows us to get patients up and moving more quickly. And in a trauma situation, getting patients up and moving quickly leads to better outcomes. I'm excited about the future of spine surgery, and I appreciate the partnership that we've had with CAMC along the way to be able to continue to offer our patients, our friends, our family members here these new techniques and be able to do it in a place that is familiar, that's comfortable. People don't need to travel halfway across the country to have these things done. We're doing it right here. We're doing it right here in Charleston.